any time in your life, and multiply this by 10 if it happened when you were a child. Any time in your life that you have lived with somebody else who has impacted you or has impacted your life in a significant way that was detrimental. That would be one way of defining somebody who is likely to develop codependency characteristics. So let me back up one more step. A lot of folks use this term a lot. You'll see it in culture, you'll see it in TV programs and movies occasionally, and it's often used incorrectly. You'll see it used by therapists, often incorrectly. And people think it means dependency. There's an aspect of codependency that's about dependency, but people think of it in the classical terms of, oh, they're dependent on each other. You hear people say they're codependent on each other. You'll hear that phraseology, and it's a rather incorrect use of the term, because it's not simply about dependency. It's about being co-affected. It means that you're being impacted and affected by somebody else's affliction. And I'm using the term affliction to mean that somebody else who is encumbered in some way. They're having a difficult time in their life for some reason, whether that's an alcoholic who's not in recovery or a drug addict, whether that's somebody with ADD who's not treating it, somebody with a mental illness like depression or anxiety and they're not treating it, they're not getting help for it, or it could be somebody in a wheelchair. If you can have a person who's got a physical handicap who needs your help and assistance, and you step right into this, I'm being impacted by their affliction and now I'm in this caretaking role. So codependency is simply a way of coping with being impacted by somebody else. And if that happened when you were a child, it ramps it up quite a bit. And we'll look at why here in a minute. But it can happen anywhere, anytime in your life. You can have a short-term romantic relationship with somebody, maybe 3-4 months, who's got some condition that's really impacting you, and you can develop some of these characteristics. They may go away in your next relationship, they may carry over. But if you grew up in a family, particularly when one of your caregivers or parents, and even a sibling, is having one of these afflictions we're talking about, these codependency characteristics are likely to stay with you the rest of your life. They will be the default switch. What do I mean by that? I mean that if you're not conscious and you're not aware and you're not thinking about it and you're not making conscious choices, the choice is made for you. And it will be this script of characteristics that we're going to talk about. It means you will automatically respond in a particular manner that isn't the healthiest for you or others, unless you're conscious. When you get to the treatment part of this, treating codependency is not easy. It's difficult. It requires an ongoing awareness of the choices you're making on a regular basis. It requires an ongoing daily awareness of choices you're making on a regular basis. Because if you're not aware, you're likely to go to default. And default means I'm going to respond this way when this happens. This happens, I'm doing this. People who are serious about treating their codependency are often in some type of support system where they're talking about and thinking about this issue on a regular basis, weekly, daily basis, because they know if they're not conscious, they're acting out these characteristics. Now, like I said, the characteristics of codependency, as we'll see when we talk about some of the later stages of this, can be very destructive, but they often take a long time to get to very destructive. They're often a slow progression of the impact it has on a person's life. Responding in a codependent manner doesn't totally destroy your life, whereas a drug addict's going to destroy their life pretty quickly, right? They're going to have a destruction pretty fast. Somebody with codependency can survive quite well because these are survival mechanisms. They're designed to help you survive difficulty. But they degrade at a slow chipping away kind of experience of things we value. And that's where it becomes important. And over time, they get worse. And they can get to a very severe place untreated. It can get to a very severe place where that person is losing a lot in their life. people in later stages of codependency who haven't treated it off, by later stages of life, they've lost relationships, they've lost careers, they've lost jobs, they've lost connection with their children, they're losing their sense of well-being, and that list goes on. We'll look at some of that a little bit later. So it basically means that you are affected by someone else's affliction. And when you're affected, you develop a coping mechanism, or a way of coping, let's call it that. You develop a way of coping. And when you develop this way of coping, you're going to respond in fairly specific ways. We're going to talk about those in a minute, the characteristics. And that allows you to survive that situation.